So, the first topic of nursing one-on-one is necessitation. If you have been a nurse, you know the importance of a necessitation. So, I'm sorry, I'm going to be playing devil's advocate today. In everything I'm going to be talking, I'll be playing devil's advocate. Why? Because I'm going to try and point out things we would not normally see as nurses. So this is where I am coming from. So a nurse station, I'm hoping everyone who's watching is a nurse. And if you are not a nurse, here's what normally happens at a nurse station. It's a work area for nurses where they record patients' notes, where they congregate together to coordinate how the shift is going to go. It's a reception area for visitors, for patients being admitted, discharge area as well. And this is basically the communication hub of any ward or any clinic or whatever. That's what happens in the reception. Nurse station. Why is it all of a sudden quite an important topic? Because recently I had an encounter. I was there at the nurse station and I was on the receiving end of some noise, and it was quite an unpleasant noise. This noise is the nurses talking, and I was hearing things I felt I should not be hearing. So, needless to say, at the nurse station, why was this happening? Because that's where all the action happens. It helps nurses or healthcare professionals to be efficient in the workflow during the shift. But one thing we kind of forget or take for granted is that the patients are nearby, be it the waiting area, be it the beds, be it the sitting area. The patients are nearby, just at an ear. They can hear everything. Believe it or not, what is being said at the nurse station can be heard by the patients. As far away as the waiting area, they can hear. If you're in a hospital setting, they can hear, believe it or not, be it about themselves and be it about other patients. They can hear. Believe you me, I never used to believe it, but now I have experienced it and I know they can hear. At the nurse station, although the nurses are not delivering direct care, they will be strategizing on how to cater to the patient's care. This means answering calls, doing referrals on the phone and sometimes on the computer, documenting patients' notes, collaborating with their colleagues, and handing over to the shift that is coming in as they are leaving. They also look at the treatment plan, the care plans. They'll be talking, following doctors' instructions, discussing with their colleagues whatever things they're not sure of, whatever is happening, whatever they're waiting for, be it bloods, be it scans. They'll be discussing. And guess what? The patients can hear. They might not know or understand what's happening, but they can hear all this. They will be able to hear. Whether still further investigations are needed, patients can hear. My emphasis is to just make you aware that your patients can hear everything that is being said at the nurse station. Your patients can hear you. So like I said, handover, talking and whatever, the communication hub, unfortunately we are verbal people. We vocalize things. So there's nothing we can do. This is how we communicate to pass information from one person to another. However, an awareness that your patients can hear you needs to be at the back of your mind or at the forefront I don't know, whichever you need to just remember your patients can hear you. If you had told me this a couple of years ago, I would have said, fool, because I don't know if you can tell, I've got one of the loudest voices. It's naturally loud. If I speak and I'm this close to you, you will be like, because I've got a naturally loud voice. I did not understand this concept until I was at the receiving end of overhearing. I was like, whoa, this is quite unpleasant. And the way it's being said and the tone that's being used, it's like, wow, I didn't know it was that unpleasant. No wonder some patients get upset or become skeptical. Let me not jump. Let me stick with my notes. Yeah. So, like I said, patients hear what you're saying. Therefore, you need to take care of what you are saying and how loudly you are saying it when you are at the nurse's station. Don't say I don't know what I'm talking about. I know what I'm talking about. I'm one of the culprits, loud-mouthed, so loudly. But now I understand. I didn't understand it before, but now I understand it. I actually get it. But then you'll be saying, so what do you mean, Violet? Should we no longer hand over? What are you trying to say? We need to hand over. We need to communicate. We need to collaborate. We need to, multidisciplinary action. It needs to happen. What are you talking about? Yeah, I understand handover is an important part of patient care and it provides information for patient and nurses. And it is a crucial part of patient safety. And without it, nurses, doctors, HCA, and other team members would not know what is happening to the patient, with the patient. They wouldn't know what has been done, what still needs to be done. They wouldn't know without a proper handover. And all that is well and said. Patients do understand that there is need for healthcare professionals to communicate. They do know there is need for information to be exchanged, but they do not appreciate hearing negative tones, negative aspects of their information being discussed at the nurse's station. I don't think any patient appreciates even another patient's information being discussed. This is where confidentiality and privacy comes in. Why? Because some information is sensitive and needs to be handed over quietly and privately. I remember at one time, my manager tried to have handover in a private office back there. We did not understand the concept. So as usual, we fought it because we did not understand what she was trying to put across. Now I understand what she was trying to put across. She was trying to ensure that information from other patients is not overheard by other patients. But unfortunately, it didn't work out. And then back to nurse station handover, and sometimes the progression to bedside handover, which is yuck if your information is very sensitive. Imagine just standing in the ward and the doctors are saying, oh, it's an STD, it's syphilis, in front of all the other patients in the ward. Oh, it's just a cancer. That's not nice, is it? No, it's not nice. So we need to re-evaluate how we are handing over the information to our patients. I told you I'll be playing devil's advocate. So that's just something to think about. So you need to think, so how logical is this handover? This case we are discussing, How loudly are we saying it? Can our patients hear what we're saying? Proximity matters. There are some patients who actually enjoy hearing these issues about other patients, and if they don't hear, they will even ask you, "Oh, was that Mrs. Smith you were talking about? Oh, what's wrong with her? I heard she'll be transferred to this and this. Is that true?" Because they were listening. You think they're so far away, they're at the end, babe, they can't hear. They can hear. They can hear. Your patients can. That's, if you don't get anything out of this teaching, I would just like you to remember, your patient can hear everything you are saying at the nurses station. That's just something to think about. So what happens when your patients overhear what's being said? This can lead to patient feeling anxious, distressed. Imagine hearing your name, Violet, and then soon after you hear cancer, you hear this and this. Maybe they're no longer talking about Violet, they're talking about somebody else. But you have already heard the information, you have already attached that information to your name, but it probably had nothing to do with you. So now anxiety sets in, distress sets in, because you're overhearing all these things and you don't fully understand what's happening. You don't fully comprehend, was it about you? Was it about something else? All you know is that you heard your name. So there is a risk of misinformation leading to confusion and the patient becoming apprehensive. And guess what? If they're a thinking machine, they're probably jumping to one conclusion to another, one conclusion to another, and they misinterpret what they've overheard. By the time you come to tell them this and this and this, they think you are lying because they've already formed a conclusion. Could I overheard this and this? And that is what they're expecting you to come and tell them, even though it might have been nothing pertaining to them. But they overheard, they formed a conclusion, and now what happens? They don't trust you anymore. They think you're lying to them. You have broken a relationship that was supposed to be of trust and honesty. They become skeptical and they undermine everything you're going to say from that point forth. Why? Because of what they overheard and assumptions and conclusions they came up with. If you have ever had a patient arguing with you, but, do you suppose they overheard you talking about someone soon after mentioning their name and they attached that information to them, and now they think you're talking about them when you're nothing to do with them? Can you see? Just think about it, isn't it? Just think about it. What am I getting at? All I'm saying is, nurses, you should speak quietly. That's a challenge for me. You should speak quietly when you're at the nurses station, because your patients can hear you. They can also read your body language, your tone. They are hearing, they are looking, they are seeing. And some of them, guess what? They understand these medical terms, this jargon. You think, oh, it's jargon. They don't understand it. They understand because you don't know their background. Some are doctors, some are psychologists, some are physiotherapists. They just happen to be your patient. Some are nurses themselves. They just happen to be your patient. You don't know yet what's their background. And here you are talking so loudly. A learning curve. That's just something to think about. Like I said, I did not understand this concept when I was a nurse. I did not understand it. So I am guilty of being a loudmouth and not taking into consideration the patient's proximity. But now that I've been on the receiving end of overhearing information from the nurses station, I now understand the importance of confidentiality. Doing handovers far away from your patients, unless they're in a side room, they're all by themselves. So yeah, you can do it there. The manner in which we deliver information matters. We need to show that we care. Empathy. Don't give the information in a way to say, get out of here, you time waster. Just leave. Go battle it on your own. If you die, you die. We simply don't care. Just leave. Go. Whatever happens after you leave that door, it's none of our business. Don't give information in that manner. You are nurses, for goodness sake. Delivering news to a patient is an art. Learn it as a nurse. Learn it. It should be done in a manner that shows empathy, that shows care, that shows concern, that shows that you want what's best for the patient, that shows that if they were to come back, they will be received again, not to feel like they're being treated as time wasters, not to feel like go and die, your case is hopeless. No, don't make people feel that. Something to also think about is where you are discussing the patient issue, how you are discussing the patient issue, and how you carry yourself when you deliver the news is very, very important. I end here and say, nursing is about saving lives and not being a robot. You are not a zombie, you are not a robot. You are a human treating other humans. So act human. Don't just blindly follow orders from the big wigs, because big wigs can put pressure, can't they? Yeah. So don't blindly follow orders from the big wigs. You are a nurse. Your job is to advocate for your patient. Defend your patient. Fight for the rights of your patient. Why not make a stand and fight for the health of your patients? Fight for the freedoms of your patient and stand for justice. Nursing is no longer about following orders and experimenting on people. No, it is about saving lives and giving your patient a fair fighting chance by administering the right drug at the right time, the right dose, to the right patient. And guess what? The same goes for the patient's information. I've got a lot to say when it comes to the nursing station, because I've been the nurse behind the nursing station, and I've been a patient overhearing things being said from the nursing station. I want to say, nurses, be aware your patient can hear everything you are saying at the nurses station. Wow, wow, wow. And I end there. Goodbye.